In this week's update from our Health Commissioner, Dr. Jason Orcena, we wanted to go over some of the frequently asked questions we've been getting on our social media platforms. So, Health Commissioner Orcena, one of the questions we've had is, what do our case counts? Here in Union County, we have 11 lab-confirmed cases right now. What does that case count tell us, and what does it not tell us?
So 11 laboratory confirmed cases means just that. It means we've had 11 cases of COVID-19 where a sample was drawn by a clinician and sent to a lab for confirmation that they did indeed have COVID-19. What it doesn't tell us is the extent that we have undiagnosed COVID-19 within the community. For the past several weeks, we have been telling healthcare providers and EMS and other folks, and the director has indicated this as well, that we have what's known as community spread of COVID-19. That means that it's moving throughout our community and going largely undiagnosed, either because people are asymptomatic or because folks have such mild symptoms that they don't actually go to the doctor. In both of those instances, someone could have COVID-19, but it's not going to be counted in our official count of cases at this time.
And what is one of the limitations that we're facing in trying to get a better idea of our true number?
The largest limitation we've had in Ohio, not just Union County, but Ohio from the very beginning, has been supply chain issues for testing materials. Testing has a couple of different components to it. There is the actual laboratory side where they're using reagents to test for the presence of COVID-19. There's also the specimen collection side, which is the nasopharyngeal swab, the transport media, that side of the equation. There have been supply chain issues on both of those in Ohio in particular, including Union County, but also nationally as the outbreak has occurred. Those issues still largely remain even now, and that's why testing still remains only for priority 1 and priority 2 groups.
Okay. The other question we've received on Facebook a number of times is, can we or why don't we share more information about each individual case that we have recorded here, specifics about their geographic or where places they have visited? Why don't we share a little bit more detail about each individual case?
Well, there's two aspects to that question, and the first one is, what value do you gain as a general public from finding out more information? And the second is, what are the limitations that we have relative to sharing that information? So let's begin with the limitation side. There are actually legal and ethical limitations to sharing that information. There are reasons why those laws exist and why ethically we don't share that. And that's not just for COVID-19. That occurs for any communicable disease we investigate. We investigate well over 300 communicable diseases a year. We don't share that level of detail with the community at large in any of those cases, and we certainly can't now change that for COVID-19. So the other side is, what do we need to do? If the thought is sharing that information helps protect the community, we already have community spread, so it wouldn't change the behavior we would ask of folks by sharing more detailed information. The other thing that's worth noting for folks is, for any case of COVID-19 that is reported to us, we do a fairly extensive contact investigation, which means anyone who had exposure to that case, we reach out to and talk through their exposure and what they need to do to protect themselves and their families at that point. And that occurs not just with COVID-19, but any communicable disease we're investigating.
And one of the questions we do get there is also on this contact tracing piece, the contact, the level of contact too. We don't necessarily list every place a person's been because we're using guidance from the CDC to determine who are those close contacts. Is that a fair assessment of that?
Oh, absolutely. And that guidance is available to anyone who wants to search for it on CDC's website dealing with coronavirus. But essentially, we're looking for folks who have an exposure that puts them at risk. Transitory exposure, passing someone in a hallway, that doesn't necessarily put you at risk. What we're talking about are folks that have direct, close contact with someone. If you are a coworker and you're working together on an assembly line or working together in an office setting, that could present a risk of exposure. And working through that risk is something we do in that discussion. How much risk were you really in your exposure time with that individual?
One of the last questions, and maybe not question isn't exactly the word, but the issues that we're hearing on Facebook is some questions about, are we making a difference? Are all the social distancing efforts that everyone at home is doing, are they making a difference here in our community to try to slow the spread or not?
So we have made a colossal difference in the state of Ohio. All the efforts we've been engaged in, everything the governor and the director have done, have made a huge difference on the rate of new cases we are seeing at a state level. From the very beginning, this was about gaining time to build capacity in our healthcare system and our testing capacity by implementing all these really stringent requirements and all the sacrifices everyone's made in Union County and all of Central Ohio. We have slowed the rate of new cases. That has gained us the time we needed to try to build that capacity, and we've done that. From the very beginning, we wanted to make sure we had capacity not just for COVID-19 cases that need to be hospitalized, but also that the COVID-19 cases didn't absorb all the healthcare capacity, so that other normal sort of ER visits were pushed out because of the influx of cases. So folks with heart attacks, the strokes, the car crashes, that we could continue to provide that level of care. All the efforts we've made have guaranteed that those services can continue and that our healthcare systems can absorb the impact of the COVID-19 cases. So right now we're on a really good path relative to COVID-19 in terms of the case counts. This does not mean we won't get new cases. We certainly will see new cases arise, but it means that the chance of those cases overwhelming our system has been greatly diminished. So it has been well worth the effort at this time, even though it has been painful.
I think one good point to reiterate that we heard Governor DeWine mention earlier this week is, we are all making a difference, and I'm hearing you say that as well, and that we only get one shot at making sure we get back to normal life here, and so that we're going to do everything we can. And that the biggest partner, and Dr. Orcena, would you agree that the biggest partner that we've had in all this is our residents? The choices that they're making to stay home every day truly are what's driving a lot of this response.
Oh, absolutely. It really comes down to what the residents do as to how fast the disease spreads. And it is only within the power of the residents to prevent the spread of the disease, and every action they take by limiting their going to the stores, by helping out their neighbors, elderly folks, people who are vulnerable, helping them out so they can limit their exposure. All of those have made a huge difference. And that is why Ohio is doing and faring so much better than I think some of our neighboring states.
So to everyone out there, we really, on behalf of all of our staff, we thank everyone that's taking the steps that we're encouraging them to take to limit the spread of this disease and to protect not just their families, but all of us here in Union County. Thank you, Dr. Orcena, for sharing some answers to these frequently asked questions today.
Thank you for asking, and thank you for everyone who's helped out in preventing the spread of this disease.